Good afternoon. I'm Joanne Wong, Director of Corporate Services with the Greater New England Minority Supplier Development Council. Thank you so much for taking the time today to join our How to Do Business with Yale New Haven Health Systems. We have the team from Yale New Haven Health Systems who will provide an overview of their procurement program and procurement process and supplier diversity program. And before we get started, I just want to go over a few housekeeping items. So we are recording this session, and this recording will be on our YouTube channel. We will be sharing the presentation at the close of the event, and we have a large number of attendees, so please go ahead and use the Q&A box or the raise hand function to ask your questions at the close of the presentation. And with that, I'd like to turn it over to Jacqueline Upright.
Good afternoon, everyone. My name is Jacqueline Upright. I am the Chief Supply Chain Officer of the Yale New Haven Health System, and we'll talk about what is encompassed in the Yale New Haven Health System in a minute. We wanted to thank you for taking this time with us, and we're going to talk about how to connect with us and hope that we start to develop partnerships with all of you and we move forward in that direction. The slide that you see currently is what we call our triangle, lovingly, and really what it represents is the mission, vision, and values of Yale New Haven Health. While our mission is committed to innovation and excellence in patient care, we look at that through the lens of providing access to patients as well as to our community. And that's a very important thing for us, and we start all of our meetings and our days with these top of mind. A little bit more about Yale New Haven Health System. Jim, if you can go to the next slide. Who we are. We are Connecticut's leading healthcare system, second largest employer with more than 30,000 employees. Our hospital locations are 360 across the state of Connecticut, but we also span from southern southeast New York all the way to westerly Rhode Island. So the whole shoreline is pretty much encapsulated by Yale New Haven Health. Ours is a comprehensive integrated family-focused care, 100+ medical specialties, 7 hospitals, 2,600 inpatient beds, 7,900 Yale University and community physicians provide care to our patients. We became Yale New Haven Health Services starting in 1996, once Bridgeport Hospital and Yale New Haven Hospital in New Haven came together. And since then, we've expanded to Greenwich Hospital and Lawrence and Memorial Hospital, and then to Westerly. And as you all know, we're always looking to grow. It is the world where hospitals are coming together. And I'm sure you've all read in the news that potentially Prospect in the Waterbury area in Manchester may be becoming part of our family in the future. But again, why are we here? To make healthcare more patient-focused, accessible, and cost-effective. A big part of why we're here talking to you today is that we want to expand our diverse offerings. And so partnering today with the Greater New England group is hopefully going to let us do that. So we appreciate the time that you've given to us. And I'm going to let the team talk about the different ways you can get into our health system so we can start that partnership. The first person who's going to walk through things is Jim Fusco. He is my Director of Sourcing, and I will let him take over. Thank you.
Thank you, Jacqueline, and hello, everyone. Thanks for spending some time with us this afternoon. Very excited to be here. We've been planning on this for a while, and we've got a cross-functional group of folks here to present with me and Jacqueline from strategic sourcing and contracting to project management to supply chain analytics. So it's a little bit of everything to get a flavor of the whole team. So our contracting processes are evolving all the time, but we always joke here, we say we live and die by the competitive bid process. It's what governs the work that we do, and it ensures that there's a fair playing field for our processes. Not just because, frankly, that we're trying to be good stewards, more that it's really what needs to be done in a health system that gets audited by the government and by other entities. And it is something that we really don't have a choice in, and we take it very seriously. And so what we're doing going forward, and we've started doing this fairly recently, is to try to include at least one diverse supplier when available. So one of the things that we're going to need a lot of help with as we go through this presentation here and beyond are to get the list of capabilities and vendors that are out there, because that has been a barrier in the past to say, hey, we've got this service that we want to do, but we don't even know who to contact or who to go to or what vendors can handle the type of volume that Yale New Haven, as the numbers Jacqueline just described. It's a big area, and it's a lot of square footage, over 1 million square feet throughout all of our facilities. And so when you think about the breadth of services that we could need and how complicated and detailed that they are, not every vendor can handle it on a system-wide basis. So we do refer the supplier to our value analysis team whenever we have a clinical item or something clinical related. So the value analysis team is a group of nurses. Usually these nurses are have a lot of experience in our health system and beyond, and they come over to supply chain because the people that are on this call with me here, we speak supply chain. I'm a cheap guy and I love saving money, but I don't know anything about why one product is more clinically effective than another. And if it was just left up to us here in supply chain, we would probably just pick the cheapest thing. But we know that that's not the best for our patients, and that's why we have to have the nurses on staff. We do request a market analysis for every bid that we do. I want to find out what the market size is, who the competitors are in the market, and how much spend that we do versus how much spend other health systems do for similar functions. And then we try to get the product cross and price match this is for supplies, where we try to figure out how many supplies that we're getting from a particular vendor, and then what are the equivalents from other vendors as well. So if it's a bandage, we see what bandage that a different vendor than the one we currently have sells. We try to compare then the rate that they're charging us, the clinical efficacy, and so on. And then finally, we do present to the NPC Diversity Council, NPC Council, and the NPC contracting teams. And for those who don't know, the NPC is the Northeast Purchasing Coalition, and they're an aggregate group, kind of like a group purchasing organization. Think of it almost as a collaboration of healthcare systems that kind of get together, and we pool our purchasing power and our resources to try to get the best value that we can. And Yale New Haven is one of the founding members of the NPC as well. And we are also in strategic sourcing. We are the service provider for the NPC. So then there's also the non-bid process. So what we have right now is really just runs the gamut from very small service contracts for a couple $100 all the way up through billion-dollar deals that are joint ventures with other companies, and everything in between. But we do have, for our existing contracts and for things where, say, it's a company that cleans one of our offsite locations. These things don't necessarily need to go out to a competitive bid based on the spend. However, what we're trying to do now is to get some diverse vendors into the mix and see where they can help augment either augment the services that we already have, or to actually just replace them with a different vendor that we haven't used before. What our purpose there in these non-bid processes is to define the purpose of what we're trying to do and describe the background for evaluating that opportunity. And then kind of similarly to the bid process, we do the market analysis. We try to figure out if there are similar products and services that are in the Vizient or NPC portfolio. And again, Vizient is a group purchasing organization that spans the whole country. It is the largest GPO, and nearly every large academic medical center is part of it and beyond. And then NPC is kind of the quote unquote, because it's not exactly all Northeast, but the Northeast arm, and kind of a smaller, more regional aggregation group. And then finally, we do the same thing. If an opportunity comes up, we do present to our aggregate group to see if there's any interest in kind of pooling resources and frankly, trying to contract with not as many total vendors as we can. The more that we can consolidate is the fewer contracts that we have to maintain over time. And so potential opportunities. There are many opportunities across all facets of the health system. However, some are a little more realistic than others. For instance, there's not a whole heck of a lot of MRI manufacturers out there. So while there may be an opportunity for a smaller company to play in some of these areas, or a more local company to play in some of these areas, chances are that's not where we should be really looking. Where we want to look more are in the construction field. Specifically with plumbing, sign creation, and painting. Also landscaping. Again, we have so many sites. We have 500 off-site locations as part of our Northeast Medical Group alone throughout the state and into Rhode Island and New York. There's snow removal for those same sites. We're looking for specific catering for events at any of these sites, especially more of like the one-off and less of the like food service that's in our inpatient hospital locations. Hair and skin products, I've had experience with some folks who own specific ethnic hair care product companies, and can really help us cater to more of our patients. And I always like to kind of joke that what is a hospital? A hospital is a big hotel that you can go get better at, right? And as that, we have to treat our patients as guests too. And there is a hospitality factor that goes into it. Skin tone bandages are also something that if anybody out there offers, we would love to hear a little bit more about that. It would be a good opportunity to get in the door as a product supplier here. Printing and promotional products, we don't do as much of these anymore, but we do events such as the Closer to Free Ride and other community events you've probably seen around that we're always looking for really good vendors who can help us in those areas. And then finally, transportation. If it's patient transportation, goods transportation, sometimes depending on certifications and licensure, there could be pharmaceutical transportation and whatnot, and courier services as well. Now, again, if this is something Joanne has said that she's going to help us kind of get some capabilities and a list of the vendors that are interested in possibly participating, and then we can keep your names on file so that when we do go out to bid for one of these categories or need those products or services, we can reach out and include you in the process. Now, with that, I'm going to turn it over to my good colleague, Maria Russo, who's going to take you to the next section.
Thank you, Jim. Really appreciate that. So just to try to make it easier for vendors to be, proactively in our system, we want to be able to have you enter into our supplier portal should you want to just put your information in proactively. So you just simply go to our website. This link on your screen here is active, is an active link. So when you receive this presentation, you'll be able to click on the link easily. That will take you to the website. And this way you can enter your company information, or this vendor, a diverse vendor, would have the opportunity to enter their information to our system proactively. And then when our supply chain is looking for that same product or service to bid out, we can go and look on our list, our internal list. And then if we're interested, we would reach out to that vendor and say, hey, we would like to include you in our bidding process. And then if that diverse vendor is selected, we would send you a letter and enter you or connect you with our accounts payable system, which is terrific. So if you can go to the next slide, please, Jim. So with that, we do have basic contracting requirements. So there's a certification criteria that we ask diverse suppliers to meet, and that's that they're certified as minority, women, veteran, LGBT communities, or disability businesses. They would have to be certified already. And there are some basic certification requirements to that. We, as a health system, would accept private, state, and public sector certifications, must be owned by US citizens, at least 51% owned, operated, and controlled, a for-profit enterprise that's physically located in the United States or one of our trusted territories. Daily operations and management must be handled by diverse ownership, and that goes back to that 51% owned and operated. And any other criteria, you can find that on certifying authority websites. So that's information that's available to you. So with that, I'll turn it over to my trusted colleague, Natalie.
Thanks, Maria. So now that we've gone over some of the requirements, I just wanted to take some time to walk through our steps of registering in the supplier portal. As we noted in the beginning, a copy of these slides, as well as the full guide with all of the steps for registering as a supplier, will be provided to you after this meeting. So we just wanted to show you that if you're coming from the YNHH vendor site, you can use any of these links to get to our supplier registration. So Jim, if you want to go to the next slide. And again, the direct link is provided right here. Once you get to the supplier portal, this is the landing page that you're going to see. So just click on that blue link, register as a supplier, and you can begin. I also just want to note that under links and attachments, there's a copy of the guide as well. So please note that registering within the YNHH supplier portal does not guarantee access to submit bids, negotiate agreements, or become an official vendor with YNHHS. Someone will be in contact if there is a need for your product or service. Alrighty, so the first bucket or tab that you'll get to with registration is to create your username and password. So we just ask with your username, please use your email address. This is what you're going to be using moving forward. So if you ever need to come in, update information, check your status, whatever it may be, please use your email, just easier for you to log in. And for your password, we have no password requirements, so just keep record of that. And also within this registration tab is where you're going to enter all of your company information. So just make sure that you mirror exactly as it appears on your W-9. Anything that's a required field is either going to have big, bold red text saying response required, or it's going to have the red asterisk. So I always just like to know if you ever receive an error or you can't move to the next page, just double check that all the required fields are populated. Go to the next page. Alrighty, that will bring you to diversity codes. This page allows you to select any diversity codes for which your business is certified, including declaring minority, women, veteran, disabled, LGBTQ+, ownership. So we have a list here of our complete diversity codes. If there is something that you believe is missing from the list, please reach out to us because we want to make sure that this is up to date. Next tab, please.
Natalie, can I just jump in for a quick second here?
Absolutely.
So for Yale New Haven's diverse spend reporting, we're currently using a company called Supplier Gateway, but we're moving to a company called Tealbook, and they have a little more strict criteria for what they consider to be diverse spend or diverse owned. They strictly go by the certifications. And if a vendor isn't certified, or say was certified but really isn't anymore, if it fell off, or if ownership changed hands in some way, shape, or form, or even if a company went from being, for instance, minority owned, but then I know that there's a couple out there that have switched over to an employee owned model. Again, these are great, and we can classify them separately, but in order to hit our minority or women spend, veteran owned, and so on, they do have to have those certifications for it to count for us going forward.
Thanks, Jim. Alrighty, and this will lead us into questions. So here you need to complete all questions. Again, we've had folks reach out because they can't move on to the next section. So just make sure you're reading everything thoroughly, providing the most information on your company, because it's really going to help us as we're sourcing for those needs, and attach any applicable documentation for those questions. Next slide. Perfect. And then here again, as Jim mentioned, is where you can attach those needed certifications. So these are really your last two steps, is attaching any certifications for your organization. And then you can also enable any proxies. So proxies allow you to enter a contact from your organization to receive notifications and updates. Just please note that proxy users cannot take actions on any events and don't have a separate username or password. So again, just make sure you're keeping record of your username and password for login for any of those proxies that you set up. And lastly, your status. So once you're all set, you want to just double check that your status reads complete, and then you're going to be provided your supplier number. Your vendor number, supplier number are not related. They're not the same number, so please keep record of that supplier number. And again, we will reach out if your services or product are needed. And from here, I will hand it over to Esther.
Thank you, Natalie. Now, here are some tips and tricks on how to succeed in doing business with Yale New Haven Health System as a prospective supplier. The key to success, really, first and foremost, is to stand out. And the best way to do this is to thoroughly do your homework before reaching out to us. Now, in reviewing the previous registration process that Natalie has just presented, you've already taken a step toward thinking about how your business is going to be a fit for our system. But to take it to the next level, you're going to want to evaluate how you will stand out against similar businesses that are already bidding. For example, you might be able to provide us with an extensive product offering a niche category that we may not have a great variety of suppliers in, or your products might come in sustainable packaging that would be really difficult to find within other companies. Or perhaps your product components may have systems and components that are more accessible for healthcare providers with diverse needs and abilities to be able to use. Whatever it may be, make sure that your entry emphasizes what makes you shine as a business. Also, we have here to be sure that your company can handle the volume and size of Yale New Haven Health's business. As Jacqueline mentioned earlier, we do have 360 sites across 3 states. And as an enterprise that's dedicated to patient-centered care, we aim to meet our patients' needs to the highest degree. Lastly, please be patient in hearing from us. We receive hundreds of bids and registration applications every year, so we will try our best to reach out when we are bidding services that your company may be able to provide. I'm going to open it up to my team if they have any other tips and tricks they think are important, but if not, I'll pass it back to Jim to wrap us up.
Thank you, Esther. Looks like we have quite a few questions coming in that we can certainly answer on here, and we're happy to do so. So I think I have to click the Answer Live button. And Joanne, is that the right way to go about it?
You actually don't. You can just ignore that. But if you'd like to read the question out loud, and then your team can take it from there to answer, and then I'll take care of removing it so it doesn't show up anymore.
Okay.
The other option is also for those who would like to ask a question directly, you just hit the raise hand button, and then we'll see a little hand go up next to your name. We'll give you permission to speak, and you can just ask your question directly.
I might stop sharing now. Might be the, let's see, everybody can see us a little better. Okay. Well, I can get started with a couple of these questions here. One of them says that we submitted an application and it asks for a sponsor or a person we are working with. Can we put supplier diversity? Natalie, correct me if I'm wrong. I don't think that that's a required field, is it? That okay? You're on mute, but I'm assuming your head shake is a no.
Sorry, stuck on mute. Yeah, no, I don't believe it's a required question. No, I think you're correct.
Okay. And so I think, it couldn't hurt to put that in there. I think that letting us know that you are a diverse supplier could be just a little way to kind of give us a red flag, or excuse me, not a red flag, that's a bad thing, a flag to let us know that you're just different than, say, any other vendor that's out there. So it couldn't hurt, but it's not necessary. And it looks like there's someone that's raising their hand.
Yep. So Jason Corbin, if you can take yourself off mute.
Hi, can everyone hear me?
Yes.
Hi, Jim.
Hey,
So Jason Corbin here from Yale Staffing. Pleased to meet you.
How are you doing?
Great. Looks like I'll get some feedback here. Let me step in.
Sound good on my end.
Jason, you went back on mute.
You did sound good. Well, maybe while he's figuring that out, maybe we can answer another question in the meantime.
That sounds
Can you
good.
hear me now?
Oh, there he is.
Now we got him. Yes.
Sorry.
No problem.
So I represent a travel nursing agency. We do in the Connecticut area. And we're looking to onboard with, health system. Is there a different path you suggest that we should take?
Did you say a travel agency?
Travel nursing.
Still didn't
Travel
get that.
nursing?
I may resort to the chat because I'm experiencing technical issues.
Okay, go right ahead. Yeah, as soon as it comes through, we'll be sure to answer it. One of the other questions here was if a hospital shown interest in using a company for an order, is it required that there are competitive quotes and at what dollar amount? So that's a great question. The competitive bid policy is fairly strict, but at the same time also allows for some real world scenarios. So one of the things that it is at, I believe, and Jacqueline, correct me if I'm wrong, it's at a $250,000 competitive bid policy threshold. So if the spend is below that, we don't necessarily have to go out to bid. If it is above that, we do. And I believe that's for a health system contract as well. And we rarely do contracts specific to individual sites. We try to do health system contracts whenever we can. Again, the volume, our contracting team does over 800 contracts a year, so it really does multiply out quite rapidly. The only caveat to that, I'd say, is that if there is a product or a service that is specific and there is no other player in the market, like for instance, if you need to get internet services and Cox Cable is the only internet company in your town, there's no real reason that you can go out to bid because that's the only one and you really just need that service. So it is, we do have to go to bid. However, if it's an extenuating circumstance, we have to fill out some extensive paperwork and have it go all the way up to our president, who can determine if there is a bid exemption. Hope that answers the question. All right, so Jason says okay. So we're a diverse travel nursing agency and support large health systems across the US. Do you suggest taking the traditional route to onboard with the health system? We operate across VMS platforms as well. So Jacqueline, you might be best to speak to that.
Yeah,
actually.
so Jason, thanks for your question. So we have an exclusive arrangement for a travel nursing agency right now across the country. So we don't have a lot of opportunity in that space at this time because it is an exclusive arrangement with them. So apologies on that one. There's also some questions about tech services in, interpretation and some very specific ones. Jim, how do you want to handle that? Because I know you had a slide of specific things that we were looking at. I guess if the things are listed on there, then we're looking to bid out those in the near future. I don't know if you want to pull that back up, because a lot of questions are about very specific services, graphic design, printing, direct mail, such like that, bandages, and I don't know if on the call today we can cover those, but I think if it's on the list that is going to go out to everybody, we more than welcome you to apply and become a vendor in our system for consideration.
Yeah, and a lot. This is the list that we were looking at earlier. So these are the ones that are probably the ones that are closest to us looking at right away. The ones that I've seen come up in here specific to translation and interpretation services. So let's take that one for a quick example. That right there is something that we do go out to bid on every few years. Contracts run usually around 3 years or so, depending on the contract. Sometimes there'll be a 3-year with an option to renew for a couple more. But so say around a 3-year contract cycle, what you can do, and I believe that translation interpreter services one has just recently passed within the last year. So what I suggest then is to go through the supplier portal, put your capabilities as a vendor in there, and then it'll be there for when we go to the next round of bidding, the next go around. it's a very rare occurrence where we would cut into a contract cycle, unless we're having some major service issues or something like that. So, but really just getting into the portal now with our new contracting process, as mentioned earlier, where we try to include at least one vendor that we haven't worked with in the past that is a diverse vendor, to try to give some opportunity to vendors that we wouldn't have known about otherwise. Again, there might be 2 or 3 others that apply through this, and we may send out a capabilities RFI to try to get some more information about a specific company, but that'll all happen when we actually go to the bid process. And then let's see, what else do we have here? So for graphic design services, it's asked in here from Mary McCarthy, and it says, does printing include direct mail? Is there a need for direct mail for development department? And if so, is it covered under this portal, or do we have to contact the development group? So we've in the past, and I wonder if a lot of these questions are based in some interactions that folks have had with the health system in the past. You know, in the past, departments tended to do their own thing. Over the past 6 years, since Jacqueline and I have been working together in this department on the leadership team, we've really tried to bring supply chain services to more departments. So for instance, with human resources, with marketing, with IT, which we call digital technology services now, supply chain didn't have a lot of visibility into their contracts, and now we do. Is it 100%? No, but it is definitely a lot better than it was. So that's a long way of saying that going through this portal now can give you an opportunity in areas like this without needing to go through the development group, for instance, or through marketing directly to get to get some visibility. If you go through the supplier portal process, register as a supplier, put in your diversity certifications and your capabilities, then you will come up as an option for us when we go to out to bid for these services. Or if we just need those services, whether we go out to bid or not, depending on the scope of the project. In terms of specs for bandages, that's an interesting one. So specific to the skin tone bandages and hair and skin products, if you wouldn't mind, I think Joanna would probably be okay with you if they reached out to you, those folks that are asking about those specific product questions. I would be okay to just have a connection with me directly then, because then I would want to bring those to our value analysis team to at least take a look at, get a capabilities statement, and then potentially have some samples sent in so we can start evaluating. Those specific products that we're talking about here, I'll be honest with everybody, it's an idea that's been thrown out. I don't know if the organization is at the point where they're saying, yes, we're going to carve this out and include these products, but I think there's a pretty good opportunity, and I'd like to handle those directly if I could.
There's one question that's specific to the supplier registration portal that I think would be helpful. So this is from Williams Standard, and we offer services in more than one area of tech services, staffing, data, warehousing, app development. Do we register more than once? So we were shown in every category.
I think that you can choose more than one category, can you not?
Yeah, I would have to verify that, but I believe you can. And in those questions, you'll be able to elaborate. So like Jim said, when we do go out, we can pull based on, those terms. I don't believe that you need to, but I can verify that with my team. Absolutely.
So we'll say you can choose multiple categories unless we communicate otherwise through Joanne. Looking at this here, I saw that there was a question. They're kind of coming in every time one comes in, it moves up on on me. But I saw one here for a small cleaning contractor that can probably handle a couple of buildings or locations at once. Are there opportunities for a small operation like mine? And the answer is yes. So I guess what I would say is when you do the supplier portal registration, just make sure you put in what your geographic location is, because I got to imagine that it's a combination of size and also location. You don't want to be driving an hour to and from necessarily to do these jobs. So to put that in there when we go to look for vendors who can handle some of maybe our offsite locations, that would really be helpful. So for information, so I think there's a couple of questions in here about IT services. So for IT services, we actually just brought this up the other day when Jacqueline and I met with the leaders of our IT department. And Jacqueline, you could probably fill in some gaps for me here. So they are interested in talking to folks who who are diverse vendors and do have IT capabilities. Again, we're such a large organization, 30,000 plus employees, and so many locations throughout the health system that it is a little difficult to slice that up when you can just say, hey, we're using Microsoft for everything, or we're using Cisco for all of our hardware. However, it came right from the executive directors all the way up to senior vice presidents that this was important to them. So if you do have those capabilities, please register in the supplier portal and put down what your capabilities are. And then what we'll do is we'll wait a couple of weeks and then we'll pull a report. Nat, if you can help me with that, we'll pull a report from the supplier portal and filter all the ones that have IT capabilities and send that over to the DTS team here so they can see what is being offered and potentially reach out to some of the vendors on there. What else do we have here? So, and again, questioning about staffing, temporary staff for non-clinical and business services. I believe that every time I've gone back to human resources here and have asked about that, because there are a lot of temp staff companies that I've done. I've done the what do they call that? It's kind of like a speed dating thing here for the diverse suppliers where you only have like 10 minutes with each one. And I go on there and talk to so many great vendors, and some of them are in the temp staffing industry. What I would say is that, again, put your information into your supplier portal registration. I will talk to the human resources department here again. We do work with very large vendors right now, or I don't know if you call them vendors, but you know what I mean. We do work with large companies for staffing, and I think that they kind of have that covered with our enterprise agreements. However, if it is for areas that are particularly difficult to source, I know that I personally have wished I could reach out to find more candidates when it's just they're not coming through our own human resources process here. So I can definitely look into it and see what opportunities there are. Let's see. What else do we have here? Cybersecurity professionals. I'm not exactly sure. I would think that our cybersecurity is in-house, but I'm not totally sure about that. But same thing, we have an audience with our IT department, and I think that would fall under IT. We do have a cybersecurity team that works in IT and a vice president of cybersecurity as well. So yeah, I mean, and we do have a good relationship with him, and would be happy to share some contact info. I've actually shared contact information for individuals and vendors with them before, and they've been received well. Okay. Just trying to scroll through here. There's a question about promotional products. We do have contracts for promotional products. I don't know how many of them we do anymore. You know, a lot of stuff has gone off-site or digital these days. When we don't do as many uh, conferences as we once did and things like that, where you had to have those type of promotional products. However, they are still used and still made. There is a contract for it, but I'm not sure if it's exclusive. I'll have to check with our purchase services team here under the sourcing team to see what that arrangement is. But I can absolutely let them know, hey, take a peek in the supplier portal for vendors that do offer promotional products, and at least to be able to reach out one way or the other to say, hey, it's a possibility, and you know the contract is coming up, you know, in a couple of years or whenever it is, or no, we've got an exclusive agreement and the opportunity is not there right now. I think we touched on information technology services. For requirements, I feel like they talked about this the other day, Jacqueline, for IT vendors, like what their requirements are. But I don't
Yeah.
remember the specifics.
Yeah, Jim and I are just touching base for the first time with IT on this project with us. So I would submit your information, and like you said, in a couple weeks, we'll run what was submitted for consideration with that team and pull back together with them. Obviously, there's, you know, a lot of contracts in the ITS space that have to service that their plus employees, you know, like Microsoft, you know, people like that we can never get away from. But certainly willing to consider what you guys put out there and at least make a connection for them to take a look.
I think that there are like certifications, vendors who are, I know that there are Microsoft certifications and other programming language certifications as well. A good friend of mine is very much up on all of that. So I have to hear him lamenting about all those changes all the time. But I think just having those certifications is certainly helpful to prove kind of like an industry-wide competency for IT services. So, and
Yeah,
then
thank you, Saul. It looks like you're going to put your information in the portal. Yeah, we have a very robust security department, as you can imagine, because we're healthcare. And as you guys have read in the paper, you know, we're huge, you know, at-risk industry right now. So we have a large team of cybersecurity. And I always tell Jim we can never get on the internet because it's so restrictive, and I get the red screen of death telling me to go no farther. But by all means, put your information in there. But I can tell you we have a very robust department internally for those areas.
I think we're probably the only company in the country that's not Prime Day shopping all day today because we can't get to Amazon through our firewall.
We can't get to anything. We're lucky we're on the Zoom today.
Yeah. And then so then it says the last one here I see is any interest in a secondary market analysis for AI companies in healthcare for diagnostics or home care. We've started playing in the home care space fairly recently. I do not know how AI can or cannot help us in those areas. But if you put down in the vendor portal that there is some sort of AI capability, we can certainly have our Natalie's boss and her director take a peek into what your capabilities are. And that, correct me if I'm wrong, but there is a way to attach a file, just a general file to a supplier portal registration, correct?
Yep, there's lots of, in each of the questions, there's links for attachments.
Perfect. And that would be the place to put in a capabilities document. I know a lot of small vendors or, you know, that I've talked to and work with, that's always the first thing that they want to send me. They've got it ready. It's tight. It gets right to the point. And that would be really helpful.
Are there any other questions? Feel free to raise your hand if you'd like, or pop it into the Q&A box. If not, we'll give you back a couple more minutes of your afternoon and hopefully you're not jumping into another meeting right after this webinar. But going once, going twice, any additional questions? Thank you for everyone who asked a question. All right, well, with that, thank you so much, Natalie, Maria, Esther, Jacqueline, and Jim. And thank you, attendees, for participating in today's How to Do Business with Yale New Haven Health Systems webinar. We really appreciate your commitment to supplier diversity and minority business development, and for being such a great partner of G&E MSDC.
Great. We're looking forward to this being a kind of a springboard of things to come. So thank you for having us.
Thank
And
you.
as mentioned, I will be sharing the presentation and also another document for all attendees, so you can register in the supplier portal.
Great. Thanks, Joanne, for
Thank
putting
you.
this together.
Bye-bye.
Take care.